Now, while your client's in labor, we're going to be checking some specific things. So first, we need to determine that fetal position, and we're going to do that with Leopold's maneuver. We don't want a client to labor if that baby is breech or in a transverse position, right? Because those patients are going to have a C-section. So we're going to feel for that fetal back, which is going to feel long and smooth. And that's where that fetal monitor is going to go because it's the best place to hear that fetal heartbeat. Then we'll also feel on the opposite side and we'll notice some different irregular shapes, some lumps and bumps, and those are the arms and legs. Now, when that monitor's on, we can monitor that fetal heart rate. And remember, we want to see 110 to 160. That's the sweet spot. And of course, remember that that fetus is our patient too. So we're going to be watching that fetal heart rate because labor can cause fetal distress and we need to be able to act quickly. Now, once we've found that fetal back and placed that external monitor on, we're going to be monitoring not just the fetal heart rate, but also the uterine contractions. So we'll monitor these for duration, frequency, and intensity. And I want you to remember this star point. We need strong, regular uterine contractions. Those are necessary to help that cervix dilate and push that fetus through the birth canal. As those contractions happen, they're going to push that fetal head further onto that cervix, and that weakened cervix is going to dilate from that pressure. And then also remember that we want to make sure to teach the client that she is going to push with contractions when it's time. Those contractions, remember, are going to help push that fetus down, and that's going to make it a little easier. As that client's laboring, we're going to be watching the contractions, the fetal heart rate, and we're also going to be watching for cervical changes. Now remember, the goal is to get to full dilation of 10 centimeters and full effacement, which is 100%. Now during these cervical exams, we're also going to be checking the fetal station. This is going to tell how far that presenting part is down in the pelvis. When we see a negative station, that means we're above the ischial spines. That fetal head is not engaged. When we're at zero station, remember this star point, that fetus is engaged. That's exactly where we want that fetus to be. It means that fetus is locked in and getting ready to exit. Now, if you see positive stations like +1, +2, that means we're below those ischial spines and we're getting closer to delivery. And at +4 station, delivery is imminent. Now, what can you do to help promote fetal descent? Well, one of the big things is remember this star point, we want to ensure that bladder is empty. That's going to help create more space for that fetus to pass through the birth canal. We also can encourage frequent position changes and use gravity to help pull that baby down. The last piece that we'll be monitoring is amniotic fluid. We'll be watching for rupture, and when that amniotic sac ruptures, we're going to be monitoring TACO, or time, amount, color, and odor. And make sure to report any amniotic fluid that is green tinged, which can mean we have meconium in the fluid, or if it's cloudy or foul odor, which can mean there's an infection.